My name is Patricia Mora. I am from Ecuador, and I was born in the south part of Ecuador in the province called Loja. Loja is one of the provinces that has high incidence for Chagas disease. So I wanted to be part of these studies, and I wanted to be part of the communities going back into research and into science. We wanted to assess the knowledge of adolescents after so many years of interventional programs, and what is the impact of these programs and the knowledge that they have after the years of interventions. We interview teenagers, adolescents that were from 12 to 17 years old that were part of the communities and that have been living in the communities for the last 10 years. We found that most of the adolescents that were interviewed, they have a general knowledge of what the disease was. They also were knowledgeable about how to identify the vector that carries on the parasite. One of the issues that we found, though, is that there was a stigmatization of the disease. People were afraid, participants were afraid to mention that they have seen or they have the chinchorros inside their houses, but in general we found that they know how to identify and to prevent. So the practices were there, but when it comes to the transmission and the disease, there was limited knowledge. And this is a barrier for future interventional programs because being aware of the risk, it also implies having knowledge of the disease, the transmission, and how to prevent. Also, we found that adolescents were willing to participate in future interventional programs. They have really good memories about the university and the infectious and tropical disease coming to their communities, and they were willing to keep participating actively in these activities. They wanted to be part of these changes in the communities, and I think that was important for the programs that come every year to the communities. I think one of the most important things that we found is that stigmatization is a big problem among the communities. Some of the issues that we also found is sometimes people will think that Chagas is transmitted through just by touching the other person, and I think that it is important that we keep implementing these educational programs, especially to the youth, and we don't have to forget that this is a neglected tropical disease.